Ready for this video? I'm probably not. We'll see how it goes. All right. 1 year ago this Sunday, I was diagnosed with cancer. So you might be thinking, after a whole year, why are you telling your story now? So there's a couple of reasons for this. Number one, I was waiting to sort of be on the other side of it. I wanted to speak from a place past it and, be able to tell the whole story. But I realized that we are a combination of our experiences, and this is something that has a huge impact. Like, this is an experience that you don't just get over or get past. It's something that you have to live with and adapt to, and that there will never be like another side of it. So I think after a year, I realized that that's the case. I also think that after a year, I need a reason or a purpose that this happened. And I'm hoping that one of you, several of you, will finally, check in with your doctor, go for that pap that you've been avoiding. Hopefully I can help somebody else, because if I can't, I don't find a purpose. I don't have that reason for why this could have possibly happened to me. So hopefully it helps one of you. Also, when I was diagnosed, I went straight to YouTube. I go straight to YouTube for everything. And I had a really hard time finding a video out there that, gave me hard facts. I'm a researcher, so I wanted to know everything. I looked at every web page. I watched every video. I wanted to know exactly what was going to happen, how I should feel, how my doctor's appointments were going to go. I wanted to know what the doctors said, what the doctors did. And of course, every experience is different. So to get those answers is completely impossible. But I didn't even have anybody's story to relate to. I wanted somebody to tell me their story so that I could expect anything. And instead I went in blind, and it was super scary. And, not knowing is like the absolute worst thing in a situation like this. And so I want to tell my story so that, if you're going through this, heaven forbid, you can have somebody to relate to. I don't know. Like I said, your story will be very different if that is the case. But I was pleading for somebody's story. So I wanted to put it out there for that. So I'm going to be very honest about it. I want to tell facts, and I want to tell emotions. I'm not a super emotional person, so my emotions now are not going to reflect how I felt then, just based on that was a year ago, even though the emotions are very much still raw and I can remember them perfectly. But obviously my emotions now are not going to be exactly how they were a year ago. But I want to kind of be like cutthroat about it. Like, this is how it was and this is how it is. And so that you can actually kind of get a feeling for how it was or how it is. So in one video, I'm going to tell my symptoms, my diagnosis, and my treatment. Hopefully I can get through that in a reasonable amount of time. I'm guessing I'm going to have to have a part B, which will be after my surgery. That shockingly was the start of a whole new chaotic time for me. After my surgery, I would say was probably harder than the diagnosis to my surgery. I had a lot of complications. I still am dealing with a lot of stuff from the surgery, from the diagnosis, yada, yada, yada. So that is going to be a video on its own. I'm hoping that I don't have to do like a C to Z of videos, but I also want to actually help you, or whatever you're here for, answer questions. So however many videos it takes that I think is going to answer questions and help people out, then I will do so. All right. I'm going to start with like my symptoms. I'm going to go back quite a ways because I feel like this all kind of plays a factor in everything that I went through. So if you're a guy, I'm going to get into all the girl stuff. If you don't like hearing too much information stuff, then skip forward, I guess, because I'm going to be telling symptoms and that has a lot to do with girly stuff. So, okay, I'm just going to dive into it. January, I had a healthy pregnancy, gave birth to a healthy baby girl, and then I breastfed her until the following September. She was about 9 months old. And for all of my pregnancies, I noticed the biggest change in my body, in my hormones, after I'm finished breastfeeding. So when I quit breastfeeding, I noticed sort of like the first month after that, or right around that time, that I was having spotting about 3 days before my period. I would have like 1 day of spotting and then nothing, and then I'd have my period. And for me, this was very strange. I know that this can be normal for some people, and if you Google it, there's nothing out there that says it's abnormal. Like, it's so common that they just write it off as pretty normal. But for me, I have never had a day of spotting before or between my periods, ever. So that was kind of the first thing that I noticed. Then after, like right around the same time, I would say, I was noticing that after being intimate, I apologize if my family's watching this, but I would have spotting. And this is what caused me to actually see my doctor. It was significantly worse sort of each time that it happened. And after about 3 months in December, I decided to see my doctor about it. So I went into my doctor, who is absolutely amazing. She's a new doctor to me, and I switched doctors because I felt that my other doctor just sort of wrote everything off. Like, his answer was do nothing to everything. And so I'm so beyond grateful that I found this doctor. She is amazing, and she took me very seriously, which I think had a lot to do with being diagnosed quickly. So I went into her and told her what was going on, and she did a pap smear that day. In Canada, I'm not sure about other places, but they recommend a pap every 3 years. And I had one 2 years previous. So this was a year before I was due to have another one. But I had my pap, and you'll hear me talk a lot about the Canadian medical system in this, because I had, both great experiences and both bad experiences. One thing with our medical system is that results take a really long time to get back. So it was probably about 3 weeks before I got my results back, and they came back as high grade abnormal cells. So that means that they're more likely to become cancerous. So from there, I was referred to a gynecologist. Another thing in Canada is that seeing a specialist can take a very long time, like sometimes upwards of 9 months. So I am lucky to live beside a really small town that happens to have a hospital and a gynecologist right in the small town. Being from a small town, they're a little bit less busy. So I got in within like a week or two. If you have an appointment that is months out, I highly recommend you do some research into other places that you can get into faster. This isn't something that you should sit around and wait for an appointment for. Like, you have to be your own advocate on this and see a doctor that will see you sooner. And I know that's not easy. You may have to drive far to find it, but it's important. Like, you just have to be your own advocate and find somebody that will see you sooner. So I was so lucky. The gynecologist that I saw was absolutely amazing. He explained everything to me. When I went in, he told me exactly what they were doing. I had to do a colposcopy, where it's basically they take a microscope and like look right into the cervix, see the cells that are around there, and then they paint the cervix with different solutions. He told me what the solutions were, but like one was just vinegar and then something else, but the cells turn colors, and if after these solutions are applied and the cells stay white, I believe, then that means they are in fact high grade abnormal and need to be removed, or cancerous. So he painted those, and then he took a biopsy of each of those cells that said they were high grade abnormal and sent those off to pathology. So there's a couple stages to be told that you have high grade abnormal cells. That's it. That's the only thing that comes back after this. So your pap tells you that, and then your colposcopy confirms that. And then after that, when they came back, yep, they are high grade abnormal, then you get sent for a LEAP procedure, which is I don't know the exact term for it, but it's an electroloop procedure where they actually remove a section of the cervix. So it's an electronic loop, and they actually kind of like carve out part of the cervix, and that is sent off to pathology to see if those are cancerous cells. So I went, once again, so lucky to get in quick. My doctor has surgery time weekly at the hospital in this small town. I was under anesthetic. I know sometimes they don't put you under anesthetic. I have no experience with that, so I don't know how horrible that is, but my gynecologist told me, we're going to put you under anesthetic so that you don't hate me. So I don't believe that it's probably a comfortable procedure. So I went for that only about a week after my results came back. In total, we're about the middle of February now. And I got in, I came out of anesthetic. Everything seemed pretty good. There was about a 2-week recovery period for that. And I had just started jujitsu, and I was like absolutely obsessed with it. I didn't want to miss any classes. I wanted to get back as soon as I could. So I kind of like pushed the timeline a little bit, and I went back after about a week and a half. And after my first class, I was super sick. I felt terrible, and one of my sons came down with the flu. So I thought I must just be coming down with the flu. But because I had just had this procedure done, I did call the gynecologist and said, I'm really not feeling good. Should I come in? And he's like, you know what? Yeah, I have like your results back, so maybe you should come in anyways and we'll get it checked out. So I went in, and I also thought that was strange because he had told me after my LEAP procedure, he's like, I only get to the the urgent ones right away. Like you can, expect to hear from me in a month. I was like, the fact that he said that, I was like, okay, he's not worried about me. Like, I'll hear from him in a month. It's no big deal. But that was only after a week. And I was like, okay. I already didn't have a great feeling about what the results were going to be. I don't know why. It was just a feeling. So I went in. We talked a bit about what was going on. He took a look inside my cervix, and he said there was a pretty significant infection there. So that explained why I was feeling so horrible. And he put me on an antibiotic. This was one of several antibiotics that I would be put on. And already that year, sort of that flu season, I was already on antibiotics twice. It was just a horrible year for getting sick. So 3rd round of antibiotics in a year, 3 of many to come. He put me on the antibiotic, and then he sat me down on the chair beside him, and he just had that look, that doctors give. They're not going to give you good news. And I kind of knew right away. And he said, I got your results back, and they found cancerous cells. And I kind of, you kind of have this like image. I don't know why humans think this way, but when you see it on like the movies or you hear that somebody's going through it, sometimes you like picture how you're going to react. And I didn't react that way. I didn't react how I ever thought that I would react. I kind of just looked at him and I said, okay, what now? And he said, I'm going to refer you to the Tom Baker Center, which is in Calgary. I had never heard of this place because I am lucky to have never had to deal with cancer myself or any close family with cancer. So, I didn't know what that entailed. And I said, well, what do you expect the treatment to be? And he said, well, it usually ends in a hysterectomy. And, but he's like, I don't know. You'll have to talk to your doctor about that. And he said, sometimes you do have to do like a radiation or a chemo. And those words were a bit harder to hear. I felt like I could handle a hysterectomy, but treatments I was really scared of. So I said, Kay, how bad is it? Like, do you know anything about it? And he's like, I can't tell you that. Like, I don't know. You're going to have to talk to your oncologist about that. So I'm like, okay, so when am I going to hear from them? And he's like, it could be a while. I was like, what do you mean it could be a while? He's like, I would give it a couple weeks. Like, the number one flaw in our system right now is making people wait. Waiting times are out of control. And when you tell somebody news like that and then make them wait, that is the worst thing that you can do to somebody. Like, absolute worst thing ever. So I left the office and I went to the car and I was like, at that point, I kind of had my movie reaction. I phoned my husband and that's when I kind of broke down. But I got home and I have, 3 little kids at home. They don't know what's going on. They don't want to see me upset. So I kind of had a little breakdown and then I picked myself up. I, went and along with my day, like I would have any other time. That was the only way I knew how to cope. I went to get groceries. I went to the dollar store. I just needed to do anything but wallow in my pity. So that's what I did. I just went about my day. Super weird, but that's how it was. It was those 2 weeks, the 2 weeks that I had to wait for my appointment. So I did hear from the Tom Baker Center within about 4 or 5 days, and my appointment was in 2 weeks from my diagnosis. So those 2 weeks were by far the hardest of this entire journey. Not knowing, your mind goes to places that like you should never have to think about ever. And you think that your mind might have gone there before. It hasn't. No, like my mind has never been that dark before, ever. Like, no one should ever have to think about that. So, you start looking into what your chances might be. Like I said, I'm a researcher. I researched absolutely everything. Any fact that I could possibly find, I did. So, I definitely, research was helping me at that point. Luckily, the research was, very positive. My chances were good. Yeah, I don't know. I was finding comfort in research at that point. And I went through like super dark times, some days. Most days I would look at the kids and they'd be happy and I'd cry because... Okay, at this point I had a little bit of a mental breakdown there, but I didn't want to leave out what my emotions truly were because at this point they were my most important emotions. And all I could think about was I didn't want my kids to see me sad. I didn't want my kids to see me sick. And heaven forbid, I didn't want my kids to have to be without me at such a young age. So thinking of myself was not as hard as thinking about my kids, and that is what kept me awake at night. That is what had me sneaking out of bed in the middle of the night and having breakdowns downstairs for hours at a time. During the day, I could keep it together. I could appear normal and happy to the kids. At night, I allowed myself to feel all of the emotions, and those were the emotions I was really having. Okay, I just got finished saying I wasn't an emotional person, so all right. Anyway, those 2 weeks, horrible, absolutely horrible. But with research, and I kept telling myself, I've just had like 5 pregnancies. If there was something glaringly obvious, they would have seen it. I had so many ultrasounds, like, especially after my miscarriages, I had an ultrasound like every week. I mean, they would have seen something, right? So I was hanging on to that hope. I don't know, I just mentally was like, you're fine, you're fine. And by the end of the 2 weeks, I was quite confident that everything was going to be fine. I was like, I had stage 1 in my mind. I was like, we're good. I'm going into this appointment. I'm good. So I had my appointment middle of March. I think it was March 18th. And I went to the Tom Baker Center. And it was funny because the first thing I noticed was a huge sign that says Tom Baker Cancer Center. And I was like kind of mad at my gynecologist. I was like, why didn't he call it a cancer center? He just called it Tom Baker Center. And Tom Baker Cancer Center just made it so much more real. And like, to be perfectly candid with you, being at the Tom Baker Center it's depressing. It's horrible. Like, you look around and you're just surrounded by people that are at their worst. Like, and what I found so hard was I'd look around and I'd be like, I'm surrounded by sick people. And suddenly I'm like, I'm sick people. Like, when did this happen? Like, I'm like, I was so healthy. I was athletic. I always stayed in shape. I always ate well. And now I am sick people. Like, it was a horrible reality. A lot hit me when I went to the Tom Baker Center. I also noticed that I was the youngest person there by 20 years, I would say. And then you realize, like, this isn't normal. This isn't common. I mean, I was only 32 when I was diagnosed. It's not normal. And like, being the only young person there, you kind of are hit with a bit of loneliness. Like, you don't feel like you should be there. I didn't feel like I should be there. But I went in for my appointment. Like I said, I was quite confident at this point. I saw a resident. She did an internal check. So just with her hands, felt around and was noting for any like nodules or lumps and bumps that she might have felt. It didn't take long, maybe a minute. It feels like forever, but maybe a minute. And she said, everything feels good. Everything looks good. She took a look as well. And then she went over my paperwork. This is the part that I was kind of mad about, because in her paperwork, she knew the exact size, depth of the area. And that was something my gynecologist never told me. So I don't know if they got that information later on, but I find that hard to believe. I believe that he probably knew the size and the depth and maybe just wasn't confident giving me that diagnosis, the stage diagnosis. I'm not sure. I don't know why he made me wait at that point, but she told me right away. She said, we're staging it stage 1B. So I was so excited to hear stage 1. The B, I didn't really know what that meant. So she told me B is the size, the depth, was just a little bit bigger and deeper than A. That means they didn't see any signs of spread. I was going to have to do further testing to see if they could confirm that. But at that point, it was stage 1B. I think maybe that also is why he didn't tell me, because you can give this stage now, but with further tests, that stage can change. So I'm guessing he's had experience maybe with like staging 1B, getting their confidence up, and then having to disappoint later on. I understand that as well, but yeah, so stage 1B. I went for blood work that day, and then I was scheduled for a CT scan, which I got within about 4 days. I was also nervous about this. That was going to be my first test to see if there was any spread. So the CT scan, I don't know if you've ever been for a CT scan, they're not fun. So it had to be like, what do they call it? Like a radioactive scan. I don't know. But they give you this drink, and when they do the scan, it like lights things up. I don't know. So I had to drink a whole like big plastic cup of this like kind of chalky drink every half an hour for 3 hours. So I had 6 drinks, and I just had to like walk around the hospital. Sorry, was it every half an hour, every 15 minutes? Must have been, I think it was every half an hour. But every time, like the first couple drinks were fine. It didn't really taste chalky. By like the 3rd drink, I felt like I was drinking chalk. And then it was kind of making me nauseous. Like I had to pee all the time because I was drinking so much liquid. By the 6th drink, it was like I was chewing on chalk, and it gave me such a headache. Like every sip I took, it just went like straight to my head. I hated that freaking thing. Then I went in for my scan, and they inject you with, again, I don't know, some thing to make you light up inside so they can see everything. And that gives you like an instant feeling like you need to pee. You don't pee, but you just really feel like you have to. And then you can like feel the coldness of it going through your body. So not the best experience, but like tolerable, whatever. So CT scan was done. I got my results back from that fairly quickly. I think I went on a Friday, and I got my results back on like Tuesday or Wednesday, and everything looked good. There was no signs of spread. Again, this was just like one stage of checking for spread. The other stage of checking for it was the treatment plan that they had for me. They did go over this on the first appointment as well, and they wanted to do a hysterectomy. I had looked into lots of research about a hysterectomy because I had been warned that that was probably the route that I would have to go. So I have had a laparoscopic surgery when I had my ectopic pregnancy. That's what I had, and I recovered very well from it. It was a fast recovery, whatever. It felt good. So I was super confident that that was the route that I wanted to go. But my oncologist said she only does open hysterectomies. She said there's research been done that the chance of recurrence is less if you have an open hysterectomy versus a laparoscopic. So I'm kind of mad at myself right now. This is another thing that I wish I would have done differently, is I wish I would have stuck to my gut on having a laparoscopic surgery. The open surgery is a huge cut, much like a C-section, and which I've never had. My kids were all born vaginally, so I don't know. I already had the laparoscopic scars. I already knew what that was like. That's where my confidence was at. But then she was telling me that, there's this research, and I don't want recurrence. And if I did have recurrence, would I blame myself? I don't know. I was very, very torn about it. But now that it's done, I wish I would have had laparoscopic. So I don't know. If you have the choice, do your research and decide what's best for you. But I also looked into my doctor, if you're from Canada, there's a website called ratemds.com or ratemds.ca, and they have all of the doctors' names. It's a giant database of doctors, and you can leave your reviews on them. And this has never led me astray. I absolutely love this website. I use it all the time for family doctors, specialists, whatever. And the reviews of my doctor were not great. They were very mixed. They were either absolutely amazing and praising her, or not good at all, and for reasons that I was worried about. I talked to my gynecologist and I said, like, her reviews aren't great. Do you know anything about her? And he said, no, I don't. He was from a different town. He didn't go to school with people in Calgary. He didn't know a lot about her, but he said, I have seen her work post-surgery and it always looks very good, very clean. He was confident in her work based on patients that had been to her before. Again, wish I would have followed my gut. I don't think she was the best choice for me. I think I should have found a doctor that would do laparoscopic. And I just had that feeling like, I wasn't confident enough that I had to ask my gynecologist. But when you're in that situation, like, I just wanted it over with. I mean, she said she could do a surgery within a month. I didn't want to have to go through the research and go for another appointment with another oncologist and like just all of it. I just wanted it over with. So I didn't do the research that I should have. I didn't follow my gut and look at other doctors, see if I could get other doctors. That is a lesson, I guess, something that I learned and something that I encourage you to do. Find a doctor that you have 100% confidence in. Somebody that, like, I should have just gotten a second opinion on the laparoscopic surgery. Talk to somebody that does do laparoscopic and see if they felt open surgeries have a better statistic as well. I don't know. I just really failed myself there, and I am angry at myself for not looking into that further. So yeah, there's choices out there. See what they are and do what you are confident in, because I was not confident in that and I did it anyways. So like I said, she could get me in within a month. So my surgery was scheduled a month from my appointment. I believe it was the 18th or 19th of April. So I, in the meantime, tried to keep my head on straight. I informed all of my family, and one of my aunts sent me a card, and in the card there was a bookmark, and it said, but that kind of became my motto. My aunt that sent me that, her husband beat pancreatic cancer, which also really helped me. I was like, if that's possible, then this is possible. And I just really tried to stay positive, and I think I did a pretty good job for the most part. I did have to go for blood work a couple times, but for the most part, you're just kind of like sent off into your own thoughts and worries. But yeah, like I said, I was in a really, really good place. Like, at this point was by far the best that I was mentally. Yeah, I just felt good about the treatment plan, that it was going to be gone, that I was going to go on with my life. Yeah, I was in a good place. So when I went in for my surgery, still good mentally. I was physically in the best shape that I've been in my whole life. So I was confident that I could recover quickly. I could just get back to normal. I just wanted to get back to normal. So I went in for my surgery. Another thing that I'm mad at myself for, I always say in any surgery, the most important person in the room is the anesthesiologist. That person can kill you like that. So I do 100% believe that that person is the most important person in the room. So I'm laying down on the table. The nurses are great. They're talking to me. They're asking me what kind of music I like, what kind of music I want to play. It was all good. The anesthesiologist came in. He was like a man, my age, a bit older. And he was like sweaty and kind of shaky. I was like, what is going on? And he came over, and my veins are the easiest veins in the world to find. I have never had anybody poke me twice to get blood, ever. So he comes in and he's finds a vein. It's kind of taken him a while. I'm like, all right, dude, like you could poke me anywhere and hit a vein. Like this is not hard. Like I am the easiest person to do this on. So he poked me, nothing. Didn't like, has to take it out, do it again. I'm like, are you kidding me? Like, out of all the people in the world, you're the one that's gonna fuck this up. Like, I remember freaking out. And in my head, I'm like, I can't refuse him because everybody in this room then has to cut me open while I'm asleep. And I don't want to piss anybody in this room off. Which is a really hard predicament to be in because all I wanted to do is say, get me somebody else. And I didn't. He got the second poke, he got it. And I was off in La La Land. And when I woke up, oh, something else I'm forgetting. Another thing that didn't make me super confident in the doctor and the team that I had, when they phoned me for my pre-op appointment. So they do that. They phone you. You don't have to go in for a pre-op. They just phone you and ask you a bunch of questions. And on the pre-op call, they said, okay, I'm going to tell you everything that's going to happen in the procedure. Correct me if anything's wrong. So they went on and they said, your ovaries will be removed. And I said, oh, no, 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 no. They said not ovaries. Because once your ovaries were removed, then you have to go through hormone treatments. And if you keep your ovaries, then you're still able to produce hormones. So that is a huge difference in getting those removed or not. So she said, your ovaries are leaving. And I said, no, that's wrong. And she goes, well, it says in the paperwork that they are. So you're going to have to confirm that with your team when you get there. I was like, are you kidding me? Like, this is a huge, huge thing to screw up. So I went in, every single person I saw that day, the nurse, I said, can you please make sure that ovaries is not on this list? And they said, no, it looks like they're not. So that's good. And so the doctor came in. I said, listen, you have to confirm that you are not going to take out my ovaries. And she's like, yeah, no, that's good. It doesn't sound like we're taking them. That's good. So I get on the operating table and I'm like, I got to double check this. So I said, while the whole team was there, I said, are you guys not taking my ovaries? And she's like, no, ovaries aren't there. And she turns to the board and says to her nurse, so take that O off the board. So you had it written on my board as I'm laying on the table? Yeah, the whole team, I didn't get a good vibe from. So yeah, and then the anesthesiologist comes in and acts like however he acted. So yeah. Okay, so anyway, I wake up after my surgery. Everything seemed really good. I was in about 1,000 times more pain than I expected to be. I have an incredibly high pain tolerance. I don't know. And even if I feel like I'm in pain, I'm usually like can mentally get through it, like mentally zone out, whatever. Like ectopic pregnancy is extremely painful, like extremely. And if you've been through it, you know exactly what I'm talking about. And this was like, that made that look like a walk in the park. The pain was awful. And so I was quite dependent on morphine, and the morphine was not working unless it was injected. So I was asking for morphine to be injected and they didn't want me to really. So I was trying to balance my pain medication. And in my head, I thought, well, morphine's going to be the best. Like that's going to cut the pain the most. And so that's what I was requesting. As it turns out, the thing that helped me the most was Tylenol. Like there was one point where she said, I can't give you any more injected morphine because you have to go home at some point and you can't inject it in yourself. So you need to depend on oral medication. And so I was like, okay, well, hit me with Tylenol. So I took Tylenol and that did 1,000 times more than morphine. Tylenol was way better. So, yeah, I guess if you're in that position, like, try different things. Like, don't just assume that morphine's going to be the best thing for you, because Tylenol was way better for me. So the next day, she's like, all right, we're gonna walk today. I was like, no, we're not. You are insane if you think I'm getting out of this bed. And the nurse was really good. She got me out of bed, and that was one of the biggest thing that helped as well, was just moving. Like, after that, all I wanted to do was walk the halls, and that helped a lot. I continued to walk for a very, very long time. Okay, and then a bit of a side note. So I was on this ward that was quite empty. Most of the rooms were empty, but I had a roommate. She was an older lady who suffered severely from dementia. And I believe that she had me in with her because she needed somebody in a room with her. I was constantly calling nurses for her. She was asking me to open her curtain and close her curtain. At the time, I was grateful because it got me out of bed, it got me moving. Every time I went to the bathroom, I kind of would ask her how she was doing. At the time, it was okay. But now that I think about it, the last thing that I needed was to mentally have to deal with another kind of illness. I now have, like, I'll get into this later, but I have like a strange connection right now with being ill, growing old, being helpless, defenseless, that sort of thing. And I don't believe that being in a room with her was helping me. I was already quite defenseless. Plus I was kind of caring for somebody that was defenseless. Like, the nurses were really good, and when I called them, they were always there. But that whole situation was not good. And I kind of wish that I would have requested my own room, because they were there, they were available. I think they just needed her to be with somebody, so that, because she wasn't capable of pushing the nurse button herself. So they needed somebody that would call when she needed it. It wasn't the best thing for me, but yeah, that was just another little tidbit. Okay, so up to the surgery. Right after surgery, the nurse came in and said everything looked amazing. Nothing looked diseased. Everything looked quite healthy. I mean, obviously they needed to send that off to pathology to confirm it, but she was quite confident that everything was going to come back great. So that made me happy. Huge complications happened after this. Several visits to urgent cares, emergency rooms, family doctors, naturopaths, complete chaos from here for the next several months. But after 5 weeks, I did go back for my follow-up appointment, and they confirmed that there was actually no cancer at all, which was both frustrating and relieving. Obviously, completely relieved that there was nothing there, but also frustrating that when I went into that surgery, I was already cancer-free. They said that all of the cancer was removed during my LEAP procedure. So I believe that there was no way to really know that until I was done the hysterectomy. So I understand why it was necessary, but also quite frustrating that I felt the hysterectomy was a bit unnecessary, especially with all of the complications that were to come. So yeah, happy to be cancer-free, super happy to hear those words. Confused, I guess, would be the best word for that. But yeah, at this point I was cancer-free, and so many complications were left to come. So I will do a second part to this. I will have this up. I will have the part B up tomorrow, so that it's not this big waiting game. And I need to do 2 videos in 1 week anyways. So this will be my 2 videos in 1 week. I hope that, I don't know, I hope I wasn't too rambly, that I kind of made sense, kind of showed what some of my emotions were. At this point, I didn't have a lot of emotions. I mean, other than those 2 weeks that were so unbelievably hard. Other than that, I was pretty positive. I was pretty, you know, happy with how things were going, how things were coming along. So yeah, as hard as it wasn't the hard part. Yeah, so wrapping up, go get your paps, ladies. Please go get your paps. Please don't wait the recommended 3 years. Go every year. Every single year, go for your pap. I have had one abnormal pap my whole life, and that was about 10 years ago. So leading up to this pap, I had several normal ones. The first abnormal one that I had in 10 years was cancer. So don't think that you're immune. Don't go every 3 years, go every year. Also, please get your daughters or yourself, if you're young, the Gardasil vaccine. Honestly, all of this could have been avoided with the Gardasil vaccine. All right. I hope this wasn't too deep. It's quite deep. I'm not a deep person. But okay, stay tuned for part B where things get crazy.